Okay, Zoom people, can you see what is happening?
Yes.
Okay. All right, I'll let one more person in, but then after that, I have to get started. Now we're really getting started. No more goofing off and fooling around. Okay. Now, guys, it's the moment we've all been waiting for. Oh, Edith, can you also make sure, like, can you periodically move this thing around and zoom in? And because I don't even know if it could cut my head off or not. I don't know what it's doing. Obviously, I'm not behind it, so I can't see. All right. So last time, am I in the camera?
Yeah, you are.
Oh, that's good. Last time, what did we talk about?
Pathology.
Yeah, we did. We talked about pathology and tissue death. And now we're talking about death, right? So, whenever you don't get oxygen to your tissues, what happens there? Yeah, it's tissue damage, and there's other words for it. Hypoxia. And then the one that starts with an I. Ischemia. Right. All right, so we're going to be talking about cases where you're definitely not getting any sort of oxygen to your tissues. And then we have a nice background of very cold. Okay. All right. So this is something that they say a lot in the emergency room, is that you're not dead until you're warm and dead. So let's see. If somebody comes in and they look dead, but their body temperature is really low, you got to warm them up and make sure they're still dead when they're warm, right? If somebody seems dead and they're freezing cold, you can't just be like, oh, they're dead, and then put them in the morgue in the bottom of the hospital and leave it at that. Because they'll come back to life and be really mad that they're locked in a cabinet, okay? So, let's see. I'm going to, severely, oh, no, you're on erase. Severely cold may appear lifeless. And so do you just say they're dead, put them in the morgue? No. What do you do first before you put them in the morgue?
You warm them up.
You will do like a flame here. You'll warm them up. Actually, you don't want to get them that warm, right? Okay. And so basically what happens whenever you're really cold is your metabolism slows down and your vital signs kind of are lacking. And so you do kind of look dead even though you're not dead. And so if you're going to pronounce somebody dead, it's difficult to do if they're cold. All right. So let's erase all this. Zoom people, y'all awake?
Yeah.
Good. That's great. You're not sleeping. I don't know what this is about. Let's go to the next. Okay. Now, guys, I'm filled with millennial jokes. Has anybody ever heard of a show called The Simpsons? Okay. All right. Good. So, it's a joke that they've been transferred to a better hospital where the doctor has upgraded his condition to alive. Because if they look dead, and if you're not at a great hospital, they could just say you're dead. But if you are at a good hospital with well-educated young people like yourself staffing the hospital, you're going to say, no, we're going to warm them up first and then check their vital signs. I'm glad you've all heard of The Simpsons. This is good. Okay, now this is from Norfolk Volunteer Fire Department. I like that. Good camera angles there. Okay, so who's a mammal? Are we mammals?
Yeah.
We're mammals. Yes, we are. All right, we have a reflex. What's bradycardia?
Your heart beats too slow.
Yes, who said that?
Isha.
Isha is 100% right. Bradycardia is when your heart beats too slow. Okay. So, well, actually, you could have just read it here, but that's fine. So remember last week we were talking about getting oxygen to our tissues. What is the thing that I drew that looks like this that carries the oxygen?
Oh, red blood cells.
A red blood.
Red blood cell.
Yes. Who said that from Zoom?
Yeah.
Ia?
DIY.
Well, good job, Ia. This is a red blood cell. Okay? So if we're restricting peripheral is in the periphery, blood flow, and then it preserves it for your brain and vital organs. So it's prioritizing your brain and very important organs. So if it's restricting peripheral blood flow and in lieu of sending it to vital organs, what would be restricted of blood flow? That was very quiet and you didn't say your name.
Oh, the limbs, Karshni.
Karshni, the limbs. Correct. So your periphery, yeah, you're gonna maybe lose your fingers, but at least you still have oxygen going to your brain. It is a mechanism that your body uses to save the really important things. Would you guys rather lose your brain or lose your fingers? Fingers. And your body agrees. Okay. So, we're restricting peripheral blood flow, but we're prioritizing the brain and other vital organs. That's a pretty neat trick. Did you guys know that your body would do that if you got too cold? Well, now you know. Okay. This says successful resuscitation has been achieved on individuals that have been submerged for more than an hour. Did you guys know that if you were underwater for more than an hour, you could live? If the water was cold, it's not going to work out in a pool or a lake. I'm sorry. But if it's, well, I guess if the lake is like frozen on top, or if like, you know, you're in the middle of Antarctica or whatever. So guys, let's all say it together.
You're not dead until you're warm and dead.
Dead until you're warm and dead.
Yes, everyone. Very good. Okay. But again, if you're underwater in a pool for an hour, is this going to work? No. That's no bueno. Now, hypothermia can cause apparent absence of vital signs. So we're really drilling in here. If you are cold, you will appear to be dead. Does anyone know what hypothermia is?
When you're just low body temperature.
Yes, and we're going to talk way more about it here in a minute. Okay, so this is again emphasized. If you're a first responder or working in the ER, you don't just give up and put the cold dead person in the morgue. You attempt to resuscitate them. You don't give up. All right, so I told y'all we'd be talking more about hypothermia. Okay, so it is when your body temperature gets to what degrees?
Below 95.
Yes, and what should it be? What is everybody's temperature?
98.
98, it's 98.6.
Oh,
I mean,
okay.
it's not, no, nobody's is 98 points. It's around 98. You get to 95, that ain't good. Now there's degrees. There are many degrees. So we have mild, moderate. I gotta improve my handwriting. Mild, moderate, severe. Okay, so mild is gonna be temperatures 90 to 95. Moderate is your body's 82 to 90, and severe is your less than 82 degrees Fahrenheit. So, some of the symptoms that you will notice in a patient with mild hypothermia include shivering, confusion, fast heart rate. With moderate, slurred speech, loss of coordination, and drowsiness. And severe, loss of consciousness, weak pulse, slow breathing, possible death. What are your thoughts on that? Does that make sense? Okay, so I'm going to stand here. If your patient's body temperature is 83, is that mild, moderate, or severe?
Moderate.
Yes.
Moderate.
Yes. Okay. Now here are some causes for hypothermia. The most obvious cause for hypothermia. Someone on Zoom. I'll give you a hint. It's right on the slide.
extreme exposure to cold.
Yeah. So if you're stuck at the bottom of a frozen lake, right? So that's like usually the most obvious one. And then if it's just like if you get thrown out in the snow, or if you just don't have, if you're homeless, you don't have any place to live, and you're just like constantly like wet and cold. Shock, trauma, certain medical conditions can also cause hypothermia. A very interesting one that I don't know if you guys have any knowledge of. Well, hopefully not. Alcohol and drug use. Nobody has any first-hand experience in any of this. But alcohol can cause hypothermia. Did anybody know that? Okay. So I will explain how alcohol can lead to hypothermia in a minute. But back to hypothermia. What are some not really good things about it? Is it fun and enjoyable? Does your body have a good old time? What happens?
It has a negative impact on your body function and your brain.
Yeah, it absolutely does. It's 2 thumbs down. I'm going to tell you, if you guys can pick between having a temperature of 98 and having a temperature of 95, definitely pick 98, okay, everybody? Right? Because hypothermia affects your... Let's all say it together.
Brain and heart.
Now, are your brain and heart important? Yes. And then when your brain isn't working, you become confused. And then, are you sharp on your reflexes? No, you got your slow reflexes. And who knows what an arrhythmia is? It has to do with this.
The irregular impulses.
We have a regular heartbeat, right? So your heart is having, here, we'll put a sad heart. Look at that, so sad, arrhythmias. And then when you don't get your oxygen to your tissues, you get organ failure, and then, okay. So, is hypothermia good or bad?
Bad.
Very good! If there's one thing you could take away today. Alright, so, I know you're all dying to know how alcohol could cause hypothermia, right? Don't do drugs, kids. This is what we're talking about. Now, let's say we have a cross-section of your blood vessel. What is it called when it goes like this?
Constriction.
Constriction. Now, what is it called when it goes like this?
Dilation.
Dilation. So, alcohol causes blood vessel
Dilation.
Yes! And just so everybody can see, here is a look, blood vessel dilation. How do you like that? Nice. Okay, so if alcohol is dilating now what did we say the peripheral stuff was? Was that like really important stuff, like heart? Yes, it's the limbs. Peripheral stuff isn't like your heart and brain, okay? Peripheral stuff is your fingers. Here, I'm gonna draw. We'll do like pink nail polish. Here. How do you like that? Okay, so there's a finger, right? So everybody knows what the periphery is. Okay? So if your peripheral blood vessels are dilated, that's not going to prioritize more important areas of your body. But it will make you think that you're warmer than you really are. And that is a false sense of warmth. So, you guys don't know what it is like to be drunk. So I will tell you, but I don't know either. If it's cold, you're not going to really notice. Now back in the 2010s, we used to go out in the freezing cold with no coats and short skirts, and you drink and you don't know how cold you are. And that's how you get hypothermia. So don't hit the clubs and get drunk and walk around with scantily clad outfits, because you won't even notice how cold you are, okay? You lose heat rapidly when you're drinking, right? So first of all, you don't know what's going on. You're wearing your club outfit. It's freezing cold, but you're drinking and you don't know how cold you really are because all of your peripheral blood vessels are dilated. And your body's like, why are you doing this to me? All right, so your core temperature drops, okay? And you don't want that. So you feel warm, you're hitting the clubs, and you're like, man, it's so warm. But you're not really warm. Now, does alcohol make you have good judgment or bad judgment? Correct, everybody, bad judgment. So, if you're having bad judgment, are you going to remember to wear your coat when you hit the clubs? No, you're not. And also, are you going to be able to seek shelter, or are you just going to walk down and up DuPont Circle? You're not going to seek shelter. And then you're not going to notice the hypothermia symptoms because you're too busy thinking about where you're going to go next. You're bar hopping. So you don't want to do this, anybody, okay? And you stay in cold environments longer than it's safe. I think this would be like a good orientation to college, right? Like, and then what's another thing, don't look, that alcohol can do? If you drink enough alcohol, all right, you're going to pass out. If you pass out in the cold, that's not going to be good, right? And then, look, pass out outdoors in the winter, hypothermia. And then if you're drinking, you might not be able to shiver, and you're not going to be able to move or get out of the way or seek help. And then it's just a prolonged exposure without any defense against the cold. And alcohol inhibits thermoregulation. Okay? So, actually, somebody on Zoom, what part of the brain helps with thermoregulation?
Hypothalamus.
Yes, because it's right here, right? It's the brain's thermostat. So, I'm going to draw a thermostat. Is that okay, thermostat? We got the mercury here. And then what degree do we want? 32 degrees Fahrenheit. So your hypothalamus is your brain's thermostat. If you're drinking, it's not going to work right. And then you're not going to shiver, and then you're not going to vasoconstrict. And again, what's vasoconstriction?
Vessels closing up, constricting.
Right. So like this.
Getting smaller, yeah.
All right. So just so we all know about vasodilation and vasoconstriction, I'm going to have, all right, we're going to say that this is where the blood vessel usually is. This is a cross section, everyone. We understand what a cross section is? Yes. We know what a cross section is? Yes, yes, okay. If it goes into this direction, what is that?
Dilation.
Dilation. Vasodilation. If it goes, oh, that's not much smaller. Okay, what's that one?
Constriction.
So that's vasoconstriction. Okay, there. So whenever you have alcohol, it's hard for you to do vasoconstriction. So your body becomes less able, not only does your body have a hard time dealing with cold temperatures, your brain isn't making good decisions for you to keep yourself warm anyway. So don't drink alcohol or do drugs. How about that? And then we have alcohol increases heat loss, decreases awareness, impairs your body's cold defenses, making hypothermia a big problem and very dangerous. Okay? Does that make sense to everybody? Did anybody know that alcohol could cause hypothermia before today? Okay. All right. Now, there's a whole bunch of cases and articles and Netflix documentaries that we're going to talk about regarding cases where people were seemingly dead for a long period of time or deprived of oxygen and somehow came back to life. But all of them were very cold, and that is why this happened. Okay, so it takes around 15 minutes to become unconscious in freezing water, and then your temperature will continue to drop every minute. You stay in the water, and then your core temperature drops towards 30 degrees Celsius. Your heart could stop beating, and then it's usually game over. No one is dead until warm and dead. Right. Now, This is a guy named Chris Lemons. And his job, he's a diver. And so, does anybody know the disease that you get, that all divers have to worry about? Like the number one big disease that divers have to worry about. Anybody on Zoom? It's called the bends. Does anybody know what differs greatly when you're floating at the top of the ocean as opposed to when you're at the bottom of the ocean?
The pressure.
Correct! Who now what? Say ho. Zoom person, what was your name?
Harshini.
And what did you say?
I said oxygen.
Well, yeah, there's no oxygen anywhere down there, but you gotta bring it with you. The pressure is different. The further down the ocean you go to the ocean floor, the more pressure there is. Are we still recording? Am I still in the... Okay, I'm not like off the screen. Okay, so, does anybody know anything about deep sea diving? Well, you're about to. So, you may not know this, but there are cables and pipelines all along the ocean floor to connect one country, continent to another, okay? They don't just get there on their own. People have to go down there and put them down and maintain them. And do you think that a diver just puts on his little diving suit? This is my attempt at a diving suit. And then just goes down to the bottom of the ocean floor? No. What do you think needs to be done gradually over the
Training.
Well, yeah, training. That's, well, yeah, I hope so. Over the course of about 3 to 4 days, we have atmospheric pressure, and at the bottom of the ocean, we have tons and tons of pressure. Do you want to just go from one to the other? So what do you have to do?
Don't they go in like a tank after they come back up?
Both ways. When they go down and when they come back up, they go into what is called a diving bell. And so there's different kinds of diving bells. There's diving bells that like keep air and then you go under and it like retains air. There are, all right, so you have this giant ship, a barge, right? And inside of it, you have this like a compression chamber. And over the course of 3 to 4 days, these divers live in these chambers, okay? And this chamber gradually increases the pressure, okay? That way they just don't go from atmospheric pressure to tons of pressure, because then, well, actually the reverse, you get the bends, and your gases leave your blood, and then you die, and it's not good. So, for days, they're inside of this ship, and they're inside of the ship in a little mini ship. And so over the course of many days, they get more and more pressure. So their body gradually gets used to the increased pressure. And then they take these pressurized, so they take these pressurized vessels, and then there's an opening here, and they put a smaller one here. So then these guys go in here. And then this thing goes out under the sea. And so this pressure is equivalent to the pressure at the bottom of the ocean, so that they can go down here because they've pressurized for 3 days on board the ship. Okay, and then they go down here, and then they work on the pipelines so that all you guys can have Netflix and stuff, okay? This is a very dangerous job, in case you were wondering. Now, so this thing goes down, and they're floating around down here, and they're like outfits. And so what happened to Chris Lemons is he was trying to fix one of the lines under the ocean, and they're actually the kind of like astronauts tethered by some sort of they call it an umbilical, because you know it's kind of like an umbilical cord, right? So they're tethered here, but what happened is a big storm came, okay? And then the boat that he was tethered to moved this way and pulled him this way, and his umbilical cord got caught around here. Okay? So their air tanks have approximately 12 minutes of oxygen. So the people on board the ship were like, whoa, we have to go back because he only has like 12 minutes of oxygen. But they were in the middle of a storm, right? So it actually took them approximately 45 minutes to get the ship to go back to be where it needed to be closer to Chris. Okay? So everybody's like, okay, if he has approximately 12 minutes of oxygen and we were trying to get control of the ship for 45 minutes. Chris went without oxygen for over 30 minutes. So they had another diver go and rescue him. Okay? And he looked dead. Right? But would you guys believe that because it was cold enough at the bottom of the ocean, he wasn't dead until he was warm and dead. So, ladies and gentlemen, he's laying there. The other divers think he's dead. And I forget the other diver's name. Let's just call him Chris. The first thing, he just opens his eyes. He's like, are you okay, Chris? Isn't that crazy? So, this is a really interesting story. And would you believe that he went back out diving 3 weeks later? Mm-hmm. Yeah, determined. All right. So, and he does really interesting TED Talks because he doesn't really remember much, you know, because lack of oxygen. It was very traumatic for the rest of the crew, and specifically, there was a man on the actual ship who was navigating a sort of underwater camera, and he was like watching Chris run out of oxygen, and it was like really traumatic for the guy watching him on the underwater camera, knowing that like they couldn't do anything like at that time. So it caused a lot of people trauma, but not actually Chris himself, because he's like, I don't remember what happened, I'm just gonna go back and do more diving. But he does really cool TED Talks. Okay, so this slide is brought to you by Millie. So we're going to talk about hypoxia, which Zoom people, what's hypoxia?
Lack of oxygen to cells.
And who said that?
Karshni.
Karshni, yes. Lack of oxygen to the cells. Okay, and then does anybody know what mortality is?
Just death.
Yeah, it's death and bodily function. So again, you guys have seen this. You're not dead until you're warm. There's a theme here. So ER physicians use the phrase extremely cold conditions. Your body's what slows down? Starts with an M.
Metabolism.
Yes, metabolism slows down. You appear dead. You do checks. You don't just throw them in the morgue. You warm them up and then check again, okay? None of you are going to make that mistake when you're doctors, because this is going to be so ingrained in you. Okay. So emergency personnel show up. They provide resuscitation. We'll talk about how to warm the body up in a little bit. And then there's so many more cases. So there's a 28-year-old, 30 minutes, missing, unresponsive to painful stimuli, and then accidental hypothermia, astolic cardiac arrest, 5.5 hours of cardiopulmonary resuscitation. So they're really putting in a lot of work. And then he was rewarmed, which again, we will talk about how to rewarm somebody in a minute here. All right. Now, does anybody know, this is slightly off topic, but not really. Does anybody know what cryogenic freezing is? So, what did we say happens to your body whenever you get hypothermia? It slows the word that starts with M that I just asked about.
Slows down the metabolism.
Correct. So if your metabolism slows down, people are like, oh, I'm going to hack the system and purposefully freeze myself. Now, there was a rumor, which Millie dispelled for us all, that Walt Disney was frozen and to be thawed and returned to life at some point in the future. It's not true. But that was like I guess an old wives' tale it was just a rumor. And Millie has discovered that it couldn't be true because Disney died in 1966 and cryogenic stuff didn't start happening until after he was dead. So probably not frozen somewhere. But people, I guess, eccentric billionaires and stuff look into this sort of thing. So you can freeze all kinds of organs. In fact, I am paying a wonderful monthly fee to freeze the what is it? Cord blood of my children, just to use in the future in the unlikely scenario that they have some sort of disease that would require this sort of cells. So if you have tissue and you need to preserve it, you want it to be cold. So if you work in like a funeral home, well, more like back to the morgue, they have freezers and they have refrigerators. So they use the freezers if they can't do the autopsy right away or they need to preserve it for like something that has to happen in the future, like a specialist, because freezing can also have some detrimental impacts to preservation of the body. But if you need it, just like with food, if you make something and you're not going to use it for a long time, you put it in the freezer. But if you're going to have it soon, you put it in the refrigerator. So I hate to compare humans to food, but it's a similar thing. So if you have the body and you just put it in like a cooler that isn't frozen, that is more if you're going to do the autopsy like soon. But if for some reason the feds need to come in, but they're not coming for like another month, you'd put the body in the freezer. Okay? Preservation. All right, so cold water is, again, the one that makes the most sense. Accidental hypothermia. Your Zoom people, your temperature drops below what degrees Celsius?
35 degrees.
All right. And we actually said this earlier. How many minutes until you become unconscious?
15.
Who said that?
Ananya.
All right. Well, good job. And then your temperature continues to drop for every minute you stay in the water. And when your core temperature drops lower than what degrees Celsius could your heart stop?
30 degrees.
30. Okay. All right. And then you're not able to pump blood. And then what happens if you don't get the blood to your tissues?
Tissue death.
Tissue death, hypoxia, ischemia. Right. That's a good one. Yes. Okay. We discussed it last week's mini med school lecture. When the organs do not get blood, that is a bad thing. It makes your organs very sad. Look at that. Okay, now first responders engage in resuscitation and they start warming the patient. And I'll tell you how they warm patients soon. You're in suspense. Holy moly, we're only halfway through. I gotta speed this up. Okay, reflexes kick in at lower temperatures. We'll just skip that, but okay, so there's another case. I can't pronounce Anna's last name. She was skiing and she was trapped under ice for 80 minutes. Crazy, right? And she didn't have a heartbeat for 40 minutes approximately. And look, oh my gosh, her temperature dropped to 13 degrees Celsius, which is 56 degrees Fahrenheit. That is wild. Okay, so she was in Norway. Makes sense, pretty cold up there. And so she was clinically dead, and then she went to the hospital. They did cardiopulmonary bypass, which is a heart-lung machine to gradually warm her blood. And she was legally dead for 3 hours. 3 hours! And she made a near complete recovery, and she was actually a radiologist. She was a doctor herself. And then, I mean, this is really like a wild case. Can you imagine? Clinically dead for 3 hours. And then she helped popularize You're Not Dead Until You're Warm and Dead. So there's a lot of cases like this. It's kind of crazy. So clinical death is when you have no pulse and no respiration. And let's see, she had hypothermia, so that's what slowed her metabolism. Very good. Okay, so when you're a doctor, you will have to pronounce people dead. And no matter what specialty you go into, I mean, I had to do this a lot, and I'm a psychiatrist. So obviously you want to make sure the patient, you have the right name, because that would be a horrendous mistake to pronounce the wrong person dead. Okay, are they responsive? Are they breathing? Do they have a pulse? You need to do neurologic signs. You look at their pupils, corneal and gag reflex, and pain response. And then you record the time of death, and then you want to tell the family. And then you make a death certificate, okay? And how to write the note. So a simple note for when you're a doctor and somebody's died, and you made sure that they were warm before you started writing this note. Would you write this note if they're cold? You wouldn't. That would be jumping the gun. That would be way premature. Okay, patient found unresponsive, no response to verbal or painful stimuli, no spontaneous respirations, no heart sounds, no palpable pulse for 60 seconds. Pupils fixed and dilated, no brainstem reflexes present, time of death pronounced, and then you put all the dates, right? And then you sign. Now, to recover people, they use, so this is ECMO, which is extracorporeal membrane something. And that just means that you use machines to function as organs outside of the body. When I worked in the neonatal ICU, many of the babies were hooked up to ECMO machines. It basically functions as your organs externally. You can do this with adults too. And then this woman, her heart started several hours, 3 hours. She had full neurological recovery. And so there's a lot of documentaries, because this has actually happened, believe it or not, many times. So we have some recommendations in case you guys want to check these out. PBS always has good stuff. PBS, yes. Extreme stress, exploring oxygen deprivation. You see why I taught you guys about oxygen deprivation last time? So we can pull it all together for this lecture today. And then hypoxia, you guys, it's back. Hypoxia, it never left, okay? All right. Now, this is just the picture, Beyond Human Limits hypoxia, because there's a lot of like videos and Netflix documentaries and that sort of thing. Ice diving and rescue under the water and all sorts of things. Okay, so hypothermia lowers oxygen demand, allows for extended survival without oxygen. Right. And you have to rewarm people. This is the theme here. You guys getting it? You have to rewarm them. Now, how do you rewarm them? Do you just throw them in a hot bath? No, that's not how you do it. Okay, so there's types. There's many different types of rewarming. Okay, so we have passive external rewarming, okay? And this is appropriate for mild hypothermia. Now, do you guys remember there were 3 types of hypothermia that we talked about earlier? Mm-hmm. What were they?
They were mild, moderate, severe.
Correct. And what were the temperatures for each?
It was, I know that severe was 82 below, and then moderate was from 82 to 90 or 95, and then 90.
No, 90. Anything
90.
above 95 is like okay.
Yeah, 90, and then 90 to like 95 is like mild.
Something like that.
Yeah.
I'll give you full credit for that. So if you have mild, you can use passive external rewarming. It's when the patient can still. All right, the patient can shiver, so that's only mild. Okay. Now, you can use warm blankets, dry clothing, heated room. And do you see how the non-alcoholic fluids, you can give them fluids, but don't pour them a shot of whiskey. That's not what you want to do. That's how they got into this situation in the first place. Okay, now we have the next one, which is active external rewarming for what type? Moderate. Okay, so when shivering stopped or they seem more impaired, it's like a more serious thing. You gotta get a little bit more extreme with your measures here. So you start using warm bottles, heating pads, and a bear hugger. And I'll show you a bear hugger in a little bit. Everybody get excited. And then radiant heat, okay? And then we have active internal core warming. So we have passive, active, and active internal. Okay, so passive external, active internal. And so this is levels of degrees of severity, okay? So this is for what kind of hypothermia? Severe. Very, very, very cold. Okay, so these are critical care methods. Warm fluids, warm humidified oxygen, peritoneal lavage. Let's all say peritoneal lavage. Yeah, okay. Bladder or thoracic lavage, extracorporeal warming, like that ECMO machine that I had mentioned earlier. These are obviously extreme measures, right? Would you hook somebody on to ECMO if they have mild hypothermia? No. All right, now, cardiac arrest or core temperature lower than 82. Brilliant. And so remember at the beginning when I said, like, if you need to rewarm your patient, do you just throw them in a hot bath? No. Much like you wouldn't take the diver and throw them at the bottom of the ocean with the crazy fast change in pressure, you don't want to change somebody's temperature crazy fast either. Rewarming someone too fast is dangerous. It's all about subtlety. It's all about being gradual. Okay? So, gradual is important to avoid this thing called after drop. After drop is where the cold blood from the limbs rushes to the core and makes the whole situation worse. Do you really care if the blood in your limbs is cold? I mean, you do, but in comparison to the blood going to your core. Remember, if you have to pick between your brain and your fingers, you're gonna pick brain. Yeah, okay. And so, guys, let's all say it together.
No one is dead until they're warm and dead.
No one is dead
until they're warm.
Okay. Do you want to get some footage from the back to get the back of everybody's heads so that we know that people are at least here? Okay, aggressive rewarming and resuscitation should be attempted even if the patient appears clinically dead. So don't just toss him in the morgue. Don't do it, guys. Now, I told you that I would tell you what a bear hugger was. So guys, this is a bear hugger. B-E-A-R. Bear hugger. Does this make you warm? Does everybody feel a little bit warmer on the inside? Okay, good. Now, this is a bear hugger, which is B-A-I-R. Do you see the difference? Okay. This has warm air coming in. It's like a balloon blanket, and they shove in warm air. This is a bear hugger, spelled B-A-I-R. Okay. Either one will work, but this is more clinically appropriate. Guys, come on, these jokes are good. Come on. At least I think I'm funny, right? Okay, the principle. Guys.
You're not dead until you're warm and dead.
There you go. Okay, and hypothermic cardiac arrest. Resuscitation efforts continue until the patient is
Rewarm.
okay, so well, this is important, you know, if you work in the ER or wilderness medicine or cold water rescue or any, you're in the Coast Guard, or, you know, stuff like that, right? Now, avalanches, drowning, cold exposure, EMS, ER, these are the type of situations that you'll see this. If you go to medical school, you have to do all the different specialties. So even if you're going into dermatology and you think, I will never have to engage in any of this, you will. because you have to rotate through them all. Okay, so we have more reading and resources if you guys want to watch some. I am a super big nerd, so I think that the documentary is really cool and fun to watch, but like, you know, it's optional if you want to. There's like really interesting articles about this, so I'm just like letting you know that it's out there. And then here's some sources. How do you like that? Everybody did good, yay! Okay, does anybody have any inquiries? Did everybody get a little bit cold and start shivering? Yeah. Anybody on Zoom have questions?
No.
Are your minds blown? Yes!
Yeah.
We have three blown minds. Okay. Well, I don't know about you guys, but I think it's a really cool topic. Does anybody want to go into emergency medicine? You guys are all going into derm.
I mean, I'm currently studying to become an EMT, so I'm like.
This is perfect for you then. This is exactly the bread and butter stuff for EMT. Okay, good. All right, are we done? Is everybody good? Everybody feels like they learned a lot?
Yeah.
Yes, that's the spirit. Okay, thank you, everybody. You are dismissed.